Welcome everyone to the fourth annual CERSI Summit in Regulatory Sciences and Innovation. I'm Kathy Giacomini. I'm the co-principal investigator of the UCSF-Stanford CERSI, which sponsors this event every year. And I'll be giving some very brief opening remarks together with my colleague Kuldev Singh here. And Kuldev and I have been working for years together on these CERSIs, together with others on these CERSI summits. But this is the first time we've seen each other well, we saw each other one time, but this is almost the first time we've seen each other in the flesh in a few years. So it's great to be back in person. We're all very enthused about this hybrid meeting. We have technical difficulties. Luckily, most of the day is panel discussion, so not too many slides anyway, but the screen's not working, so this is the only place the in-person audience can see any slides, but like I said, most people aren't using it. So the goal of our summit is to increase awareness in all sectors about research in regulatory science. And that research we know is critical to FDA because FDA policies, guidances, reviews, everything is based on evidence. And to generate that evidence, they need to do research. And most people think of FDA folks as involved in review, but we don't really think of them doing research. But in fact, they have an intense research mission. And to help them carry out that, and they have a research mission across a broad swath of products, ranging from drugs, biologics, all the way to digital health, cell-based therapies, you name it. And so we define regulatory science research, because it's very broad, as research that just helps FDA and other regulators make better decisions. So to help them in their research mission, FDA has harnessed the academic powerhouse, the research powerhouse in academia. And they have funded and supported for the last 5 years at least, CERSI, Center of Excellence in Regulatory Science and Innovation. And you can see 4 of them here that are funded by the FDA. I'll say it out loud: Yale Mayo, Johns Hopkins, University of Maryland, and UCSF-Stanford. And every one of them is here today, and we will be showcasing our research in a poster session, yay, a live poster session today, at the end of the day in a reception. So you'll be able to see examples of the research that are going on in our CERSIs and the other CERSIs around the country. And we're in a renewal right now, so we're hoping to get other CERSIs involved at the end of the review of our CERSIs. So I like to highlight a few examples of research projects, just so you get an idea of the breadth of research that is taking place. And the first thing to know about this research is the research is all collaborative, with FDA scientists working together with academic scientists. And that really, I think, makes our CERSI special in that it's a collaboration. Most of the research projects are often initiated by the FDA to address critical issues that they need to have research carried out on. So we're right now, our own UCSF-Stanford CERSI is supporting about 38 projects, research projects, collaborative with different centers at the FDA on different areas. So let me give you an example. So one project, this is being done at Stanford and together with FDA scientists, is to look for off-target sites of CRISPR-Cas9 gene editing. Off-target sites can cause adverse events, and FDA is very interested in understanding the best way to identify those off-target sites. So they're working with folks at Stanford through our CERSI. We're all interested in increasing access to clinical trials for all Americans. And there are a lot of different barriers for that. But one of them is just simply the electronic support systems. So Laura Esserman and her crew are working to make that easier, where you have the electronic health record and the clinical trial database system all together in one site, making data entry easier, making access to clinical trials easier, making for people, for example, not in academic medical centers, which I think is nice, or not near those. So we have an opiate crisis in this country that we're all aware of. And so one of the innovative projects that's going on at our CERSI is to try to use virtual reality for pain. And if virtual reality can help alleviate pain, that may reduce dependency on opiates and therefore help in the opiate crisis. So that's one project, and I'm sure the other CERSIs are involved in other projects because it's a critical issue going on in the country. And finally, the last one I'd like to give an example of is we in the University of California have knit together all the electronic health records from all the different UCs, so like UC Irvine, UCLA, UCSF, so into one big electronic sort of database, and we call it the UC Clinical Data Warehouse. And FDA has taken advantage of that clinical data warehouse because they can use it now to monitor, and here I'm showing a project that Atul Butte and his colleagues are doing to evaluate the safety and efficacy of vaccines, biologics, CAR T cells, you name it. So that's been a really great boon to the FDA and also great to our academic scientists. So we're going to have some really fun interactive panels today. And as I said, at the end, we're going to have a poster session in which we'll have a lot of posters showing different projects, which I think you'll all enjoy. And Kuldev will describe the day. And I'm just going to end by thanking all the people who are involved in our CERSI in organizing this event. I want to particularly highlight Laura Esserman, Superwoman, who has been involved in organizing the CERSI Summit for many years. Kuldev Singh, also very highly involved in our CERSI. Andy Plump. And then two people who are working behind the scenes, Lawrence Lin and Nathan Dang, who have really done the heavy lifting for this event. So, and then finally, and most importantly, our sponsors who help us fund this event every year. So thank you, and I'll turn it over now to Kuldev.
Thank you, Kathy. So this is our fourth summit, and really appreciate Kathy's collaboration on this. This has been a wonderful adventure. And really the reason for this summit is the fact that we want to stimulate dialogue between stakeholders and innovation. We felt it was important for FDA to have a seat at the table. We had a lot of support from Rob and Caleb, who's here today, Jan Woodcock, and others to get this going. And I'm going to highlight the power of CERSI. I think Janet said it a few meetings ago. Money spent on CERSI, on regulatory sciences, yields a very high reward, and I think we think that's true. It's definitely a high return on investment. And we also want this to serve as a networking opportunity, and many of you are attending a big healthcare conference coming up this week, so we felt this would be the perfect time to do it, even though usually there's a storm system coming our way the first couple of weeks of January, but we do it now because people are already here. We did it in person in 2020, and 21 and 22 we were virtual, of course, for obvious reasons. We're back in person in 23. The highlights today include Kathy's beginning with giving you some information about CERSI and our CERSI in particular. And we have for the first time, we have a year in review talk, and we're grateful for Commissioner Caleb to join us to really tell us what's happened at the FDA over the past year, and just can't think of a better person to open our meeting. Panel discussions on timely topics, and then we'll end with a poster session. The first panel will be led by Laura Esserman and Patricia Cavazzoni. It's on disparities in clinical trial enrollment. This is a hot topic, and many feel the progress has been slow in this area, so I'm really looking forward to hearing this. Thankfully, the House of Representatives concluded their business yesterday, so Anna Eshoo, who is chair of the Health Subcommittee in the U.S. House, is going to be able to join us. The second panel will be co-chaired by Mark McClellan and myself, and we'll focus on cross-agency synergy to accelerate access. And this was really brought about. This panel, we have this panel because of much of Rob's comments talking about the transfer of the baton from FDA to CMS, how it could be better and smoother. And so we felt that this would be a wonderful topic, and we're really grateful for Lee Fleischer, the Chief Medical Officer of CMS, to take a Sunday and join us today for the first time as well. Then the third panel will bring together global regulators, regulators from Africa, from Europe, from the United States, as well as others that are interested in building a global regulatory vision for product and drug development. This will be co-chaired by Kathy Giacomini, as well as Dan Hartman, who's here in person from the Bill and Melinda Gates Foundation. And last but not least, FDA Chiefs Chat is back. We had it last year. Andy Plump and Janet Woodcock will co-moderate this again. You know, one measure of success of a panel is the response we get from the audience. And please do give us feedback. There'll be a survey at the end of the meeting. But another measure is how much the panelists enjoyed it. And I'm pleased to say that all 4 of the FDA chiefs, past and present, are back. I think Rob was commissioner in waiting, or whatever the term is, last year, but now he's back as commissioner. And I think they enjoy it as much as we do. So this, I think, is going to become an annual part of our meeting. And as Kathy said, we'll end with a poster session. Tina Morrison, who's director of the Office of Regulatory Science and Innovation at ORSI at FDA, is going to join us. And I just want to once again reiterate my thanks, or reiterate the thanks that Kathy pointed out, that there are several people involved in this meeting. Nathan and Lawrence have been doing the heavy lifting behind the scenes. Laura, Kathy, and I have been there from the beginning, and Andy Plump joined us 2 years ago, and as with anything Andy joins, he brings intellect and energy. It's been great to have his input in the development of this program. I want to thank Amy Hu from Stanford Video, the UCSF volunteers who are here on a Sunday, the conference event staff, and our sponsors. Pull out your cell phones, turn them off, put them on mute, and mark down January 7th, 2024. That'll be the date of our 5th Innovations in Regulatory Science Summit next year. Sam Hawgood has been here at each of the summits, virtually or in person. Sam is Chancellor at UCSF. He's a huge supporter of CERSI, a huge supporter of our summit. It's just so great that he takes time to join us every year, and I'm looking forward to hearing his opening remarks. Sam.
Thank you, Kuldev and Kathy, for getting this summit kicked off this morning. Kathy told me it wouldn't rain, so she's got dialogue with someone that I don't talk to. But I hope we stay dry, and I hope you all enjoy this, the 4th summit. It's only the 2nd in person, but I congratulate Kathy and her partner, Russ Altman and Kuldev, for conducting 2 of the prior summits completely remotely, and now we can take advantage of the opportunity to also have a hybrid. So I welcome also the roughly 1,000 people or so that we believe are dialed in remotely listening to the summit. I would just echo what Kathy said. These CERSIs are remarkable organizations that I think are somewhat unique in the sense that they bring great academic institutions together in a true partnership with our government sponsors, in this case the FDA. And the work in regulatory science in order to assist the FDA make better decisions, I think has been borne out over the 4 or 5 years that the CERSIs have been in existence. In fact, the last two and a bit years, almost 3 years now, have emphasized how critical it is that we have a body like the FDA, and I particularly appreciate Rob being here and 3 prior FDA commissioners joining the summit later in the day, how critical their work has been in helping not only the US, but literally the world get through the pandemic, the effective use of emergency use authorization, and then the effective introduction of brand new vaccines, brand new antivirals in literally record time has been, I think, a remarkable silver lining of the pandemic. So I thank the FDA for their work. I'm not going to highlight what you'll hear about today because Kuldev has just done an excellent job of that, but I think the topics that have been chosen are particularly timely. The fact that we are a global world and everyone is interconnected, again, the pandemic brought that out. So the focus on global regulation, I think, is critical. The focus on access to clinical trials and the need to diversify and focus on social justice through our work in biomedicine and regulation, I think, is another topic that's incredibly timely. So I'm excited. I know my colleagues at Stanford and at UCSF appreciate all of you being here today, and I look forward to a number of great panels, and thank you for being here. Welcome to UCSF.